It's amazing, isn't it? We live in this world with robotic surgery and AI analyzing scans and personalized medicine.
It really is mind-blowing, the advancements we're seeing in healthcare.
But there's kind of this hidden catch.
Oh, what's that?
The buildings, the actual physical spaces where all this amazing stuff happens, they're kind of stuck in a tech time warp.
I see what you mean. That's an interesting point. I haven't thought about that.
Yeah, it's like we're trying to do cutting-edge healthcare in facilities built with a 1990s approach to IT.
That's a pretty stark contrast.
Why is there this disconnect between healthcare technology and the construction of these facilities?
So what happens if we don't do something about it?
Exactly. And to help us unpack all of this, we've got Teal Heath, founder of Equinox Healthcare IT.
She's got this incredible perspective because she's been on both sides.
Yeah. Started as a nurse, so she's seen it from the ground up.
And now she's leading a company that's tackling this very problem.
She's been a real advocate for change in this industry.
For years. And people are finally starting to listen.
And she's written this really interesting article about that very thing. So today, we're going to do a deep dive into her article. Try to understand why this even matters. And not just for the doctors and nurses, but for all of us, the patients.
Sounds intriguing, what she's saying.
Well, the thing that really struck me is that she doesn't just frame it as some kind of logistical problem,
Right.
like a scheduling snafu or something. She makes it a cultural issue, which is way more interesting.
Okay.
So she compares it to this story about Ignaz Semmelweis. He was a doctor back in the 1840s.
Okay, yeah.
And he figured out that hand washing could save tons of lives. Like, it seems obvious now, but back then it was a huge deal.
I bet.
Yeah, he actually faced a lot of pushback from other doctors for it.
Wow, really?
Can you believe that? But it makes you wonder what we're overlooking today, especially with something as complicated as, building a whole hospital.
That's a really good point. So is that what Heath is getting at? Like, we're so stuck in our ways we can't see what's right in front of us?
Exactly. Heath uses that Semmelweis story to show just how resistant to change the healthcare industry can be, even when all the evidence is staring him in the face. And she thinks we're doing the same thing now, just with technology, especially when it comes to, really baking it into how we build hospitals.
Right. And he does a really good job of painting this picture of how different hospitals used to be. Like in the 90s, technology was what? A couple of clunky old computers, maybe a fax machine in the corner.
Only a handful of medical devices were actually, networked.
Pagers and paper charts.
Oh, can you imagine?
Nurses literally running down the hallway to answer calls. I mean, it sounds kind of funny now, but that wasn't that long ago.
That was the reality. And then Zoom.
Totally different world.
EHRs, telehealth, everybody's got a mobile device, the Internet of Things.
Everything's connected.
And not just a little connected, it's deeply interconnected. You think about it, every single department, not a single one, functions without IT support these days.
It's true. And some departments are totally reliant on IT systems to even operate, right? We've gone from IT being this afterthought in hospitals to it being the core, the backbone of how everything runs.
It's true. Every single department, whether it's the surgeons or the people in the administrative offices, they all rely on these complex IT systems.
Totally. And not just for patient care, but for things most people don't even consider, like managing the building itself, security, even just, parking.
It's this whole hidden world.
Right.
So it sounds like what you're saying is that while all this incredible technology has been booming, and that's where it gets, I think, really interesting and maybe a little frustrating, because, we've had this massive shift in how much healthcare relies on technology.
Right.
But the way we build these spaces has not caught up.
At all. It's like we're constructing these buildings for the future of medicine, but with this seriously outdated approach to IT.
Yeah. And there's a couple of reasons for that. One is the traditional construction team, your architects, your contractors, your equipment planners.
In these technology design firms,
They don't always have that deep understanding of how it all works.
like the workflows and stuff.
Yeah. And healthcare technology is changing so fast. So you end up with these different groups who don't even speak the same language.
They just haven't kept pace with how complex it's gotten.
Yeah, it's like they're still using the same playbook from the 90s, but the whole game has changed.
100%. Like she talks about how the average hospital IT department is juggling, get this, hundreds of projects at any given time.
Hundreds. Whoa, I can't even imagine.
Right. And building a new facility, that's just a tiny piece of that. Maybe like 3 to 9% of their whole portfolio.
Oh, wow. So they're already stretched thin, and then you add this massive specialized project on top of everything else.
Exactly.
Okay, so if we're talking about building these future-proof hospitals, where do we even start? It sounds like Heath is advocating for a pretty major shift in thinking.
She is. It starts with recognizing that technology isn't just some extra feature in a modern hospital.
Right.
It is the foundation. It's what everything else is built on.
So how do we get from this mindset of, oh, we'll just add technology later, to one where it's truly integrated from the ground up?
Well, Heath believes it starts with who we bring in during the planning stages. She's a huge advocate for bringing in specialized healthcare IT experts.
So not your average IT person, but someone who really understands the ins and outs of a hospital setting.
Exactly. We're talking about people who are fluent in both tech speak and healthcare speak.
I like that. Fluent.
Right. They understand systems that work seamlessly with how doctors and nurses actually do their jobs. They know how to manage massive amounts of data securely, and they can adapt to the constantly changing landscape of medical technology.
So they're like the bridge, the translators between the architects and the contractors in IT and the healthcare professionals who will be using all this technology every day.
Exactly. And Heath, she argues that having these experts, it's not just a good idea, it's essential if we want to avoid making costly mistakes. No more nasty surprises down the line because someone underestimated the IT needs.
She's developed this whole modern approach to bridge this gap between construction and IT.
Precisely. And that's Heath's core message. We need to move beyond these quick fixes, these Band-Aid solutions, and embrace a more holistic, forward-thinking approach to how we build our healthcare facilities.
So what's the takeaway for our listeners?
Change is hard,
Mm,
but if we keep clinging to these outdated practices in construction,
it's going to have consequences.
big ones. And sometimes it takes someone like Teal with her unique experience and vision to shake things up and lead the way. That about wraps up our deep dive into the world of healthcare construction, something I think a lot of us probably don't think about very often.
It's easy to overlook.
But it's so important. Big thanks to Teal Heath. She's not just complaining about the problem, she's finding solutions.
I'm excited to learn more about how her company does this.
Me too. Let's pick it up in part 2.
Sounds good to me.
And to all of you listening, stay curious.